Hello and welcome back to Women's Health Tech Wednesdays. My name is Nina Joshi, and with me today I have Sara Chokshi. Before we jump in, wanted to give a quick background on myself. I am a consultant and design researcher at Kaiser Permanente's Innovation Shop, where I design and deploy digital health products and solutions. And I am very excited about my guest today, Sara Chokshi, who is the Director of Research here at HitLab. Welcome, Sara.
Thanks, Nina. Great to be here.
Awesome. Well, to kick things off, why don't you tell us a little bit more about your background and the journey that kind of led you to HitLab?
Sure. Well, I guess my journey to digital health started a long time ago. I had just finished a bachelor's degree in sociology and had always been interested in healthcare. So I decided to pursue an MPH at the University of South Florida, because I was living in Florida at the time, and frankly, it was in state. So yeah, and it was really one of the best decisions I ever made. It was there that I, was fortunate to take a focus group course from Richard Kruger, who's sort of one of the pioneers of focus groups.
Oh, wow.
And really got my first taste for qualitative research methods. And at the same time, while I was there, I was working as a research assistant at the Delapart Mental Health Research Institute, where I also sort of found a passion for healthcare services research and research, really focusing on the delivery of healthcare. Mm-hmm. So, from there, I decided to pursue a doctoral degree and found Columbia's Socio-Medical Sciences program, which at the time was very unique. This was a long time ago, because it allowed you to combine sociology and public health.
Oh, wow.
Yeah, so I completed my degree there and then went on to do a postdoc in psychiatric epidemiology at Columbia, and was one of the only postdocs to focus, really use qualitative methods in my research. It was a heavily quantitative group, but it was really interesting and a really great opportunity to see how qualitative and quantitative work together, and at the same time took a fascinating course in measurement from one of my mentors, Bruce Link, and really became interested in measurement as well as qualitative methods. And so, to sort of keep a long story short, I went to work for the health department in a new, it was called Quality Impact. It was a new quality improvement initiative in the mental health services, a part of the department. And, again, really solidified my love for trying to measure messy things.
Yeah.
And marry together, quantitative and qualitative methods. And so, I say all this because it seems like a very disjointed, winding path, but all of that was super essential, I think, to bring me where I am today, because from there, I ended up working with NYU Langone. From my work at the health department, I was really focused on patients and families. Mm-hmm. And I ended up working with NYU Langone for a long time on, their efforts in patient family-centered care, particularly as they were going to build their new children's hospital, and became involved in, providing, helping to get patient and family perspectives into the design, which was heavily digital. And, I began to realize, this is where I'm going to sum it all up, all of these very fundamental social science research methods from sociology and anthropology are really the foundation of what we use now in digital design and UX research and all that kind of stuff. So I, realized this and made a beeline for HitLab, because I really, it really married my love for this kind of work, this kind of research work, but in a really exciting, new, innovative way. I love the way design thinking and user-centered design takes all of these tools with lots and lots of evidence and experience behind them and operationalizes them so they're much more applicable and usable, to make great products that people love to use. So that's how I ended up at HitLab.
Love it. That sounds like such a wide breadth of knowledge. And can I just say, I love to measure messy things. Definitely needs to be on a t-shirt. I think that is incredible. No, go for it.
No, I was just gonna say it makes it fun.
Yeah, absolutely. Can you tell us a little bit more about your role as the director of research at HitLab, and what types of research projects do you primarily focus on?
Sure. So my role right now is the director of research. I came to HitLab first time around and then left to join the faculty of NYU Langone. I kind of went back, and there I was working in the Center for Healthcare Innovation and Delivery Science. I helped spin up like an informatics and design research lab there, and but then decided to come back to HitLab in my current role a little over a year ago because it really offered me the opportunity to do what I love, which is, work both with health systems, which I enjoy, but was really missing the opportunity to work with startups and, marrying startups and health systems together. And so primarily what I do now is oversee our research portfolio. But increasingly, I'm seeing myself dabbling in some strategy projects as well, and a lot. And what I love is that more and more, not just with research, but now in strategy, we're doing a lot with women's health. So it's really been exciting for me and a new challenge. So, yeah.
That's incredible. I think that the ability to not only work with health systems, but with other organizations and other startups, that sounds like a lot of really interesting perspectives when it comes to research. Well, given your vast experience and expertise, I wanted to dive in a little bit more kind of into research as a discipline. As we are continuing to see more and more healthcare oriented startups, digital tools, apps kind of enter the market, what, in your opinion, is kind of the role of research, and what role should research play in that product development?
Yeah, sure. I mean, I'm sure you have opinions on this as well, but I think, I think the more, I guess, a couple things. I think oftentimes in digital health, depending on the product, but research comes in later at the time when it's like, oh, we need some evidence. We either need to publish a paper or we need to put it in our investor deck. So now it's time to do a research study. Great. But there's also research with product development. And I firmly believe the time to do that is before you start building anything, because what an important way, and frankly can be a really simple and easy way to make sure you're staying on target with your value proposition and making sure you're building and prioritizing based on evidence, and it doesn't have to be, I think it can be a lot lighter weight and part of the flow of product development in ways that might not seem obvious in the beginning. I think for people unfamiliar with research, it feels heavy. It feels, I think there's a lot of times confusion between research for product development and research to establish evidence. And oftentimes when you say research, people only think about the latter. And so it's like, oh, we have to recruit and we have to go through the IRB and all that kind of stuff. And, yes, you do. However, there are other ways to, engage potential users and generate knowledge for product development. And easiest if it's, I'm a big fan of a research strategy, and anyone that comes to us for research services, I try to stress that, what's your research strategy? What's your plan?
Mhm.
So, and that helps, I think that helps companies realize, okay, this is what we need to do now, what we need to spend our money on now, our resources on now versus, in 6 months and down the
Mhm.
line.
Yeah. No, I like that you're kind of talking about it and how research shouldn't just be an afterthought, but kind of one of the major defining steps that you kind of take to really set the stage for what you want your product to be.
Mhm.
Yeah. And you touched on this a little bit earlier, kind of the quantitative versus the qualitative. Can you elaborate or describe a little bit more, maybe for those that are unfamiliar with the distinction between the two? I think that would be really great.
Yeah, sure. So, I think most people are more used to quantitative research, numbers, precise numbers and measurements, even surveys with close-ended questions give us what we call quantitative data. You can run statistics on them. You can look at, sample size. Do we have enough people to statistically say that, something's going on or one group is different from another group? Whereas qualitative research is interviews, focus groups, maybe it's content analysis to look for themes, themes in the things that people are talking about or things that they're saying, either in written material or it could be like online message board content, something like that, right? And so, we use both. And I think it's important to think about with research what your goals are. Oftentimes, qualitative research is super useful in the early stages when you're exploring in the exploratory phase. And I think it can really help to do a little bit of qualitative research in the beginning, because quantitative research, particularly when you're looking to get feedback from a large group of people, that can be expensive and time consuming and a bit onerous. You want to make sure when you get to that point that you're asking the questions that are, the ones you really want to ask, that they're worded in a way that respondents understand. So they're, actually touching on the domain you're interested in, rather than maybe misunderstanding a word or two there. You can't go back, right? So qualitative research is a great way to, explore not just the things that you might want to ask about, but also explore the way you ask about them and make sure that it's in a way that matches with the way your respondents are going to read them.
Yeah.
So, it's interesting as well as economical to, really leverage those qualitative methods early on and do some exploratory work before you go and then do that confirmatory work to say, hey, I have a hypothesis. This is what I think is going on. And I'm going to collect this quantitative data to see if I'm right.
I love that distinction between exploratory and confirmatory between the two. And so now, given that we are still kind of in a COVID world, how have you, done qualitative research, knowing that things like in-person interviews are probably not, appropriate kind of in this time? And then what recommendations or tools would you suggest for those that are also looking to do qualitative research in a virtual fashion?
Yeah, we much like the world of work have gone to video interviews. I think depending on what you're focusing on, if there are some sensitive subjects, and that can go either way. It can either maybe respondents might find it harder to delve into more personal issues or sensitive topics online, or as we've seen with text messaging, oftentimes around sensitive health issues, actually people can feel more free to talk because you're not face to face, and there's sort of this layer maybe that adds to this feeling of anonymity. So yeah, but that's mainly what we've been doing since COVID. In fact, that is what we've been doing since COVID, is is video.
Mhm.
I mean, the one helpful piece is at least Teams, which is what we use the most, has a fantastic transcription.
Oh yeah, that's right. Yep.
So rather than recording and then having to figure out how you're going to transcribe, you know, so added
Job done. Yeah, more or less. We also use the transcript service quite often through Teams. So that's great. So just really virtual. And then do you use any like text message or like chat-based services for that type of feedback?
We would if it were appropriate. We're not doing that right now, but I think that's a great option, particularly if you're looking for, maybe not an interview, but you're looking for some quick, a way to deliver options for quick, easy feedback. There's also what I like to call like qualitative data. So you're the responses you're going to get back, they're not that complicated. They might be qualitative in terms of their sentences or strings of words, but they're pretty simple and easy to bucket then into quantifiable, more quantifiable categories.
Nice.
So I think that can be a great way to get that sort of feedback.
Is there what have you seen? Because I think one of the things that I've definitely experienced when it comes to qualitative research is still a need to put structure around it, or to I don't want to say quantify it, but almost, just in terms of like really being able to present it that way for those that maybe aren't as used to seeing qualitative data. What are some of the things that you kind of, or recommendations that you have when you kind of get those requests to put more structure around things like that?
No, I think it's great, and I think it's super important. Qualitative data is just like any other type of data that we deal with in our world now, where we have you have so much more data now.
Yeah.
And really our challenge is, what do we do with it, and how do we present it to people in a useful way? So, I'm still a purist, but I really believe in presenting qualitative data in a way that's succinct and useful.
Mm-hmm.
How do you do that? I think it's really important to be super organized up front. And, I had somebody say to me a couple of years ago, like, essentially saying like, oh, well, you don't have hypotheses when you go into qualitative research. And that's absolutely not true. You should, have some hypotheses.
Yeah.
You might have some exploratory questions in there where you need to find out some stuff, and you don't, you might not have much of any idea what's going on in that domain, so you want to explore. However, you wouldn't be doing the research if you didn't have some idea of what was going on. And so, while the actual questions might feel very open-ended, what you're looking for is very much driven by that hypothesis and what you're looking for, and that should be set. Even if you're going back in and you're coding the data and you find some interesting things and you're building upon what you're looking for at the end, a lot of what you are looking for should be set up a priori. I'm going into this particularly with digital design, because you do have to be so specific in order for that to translate into a piece of technology. So, I think being really well prepared, really clear about what you want to find out. And, the last thing I'll say is any qualitative data set, you can go into that data set and look for anything. You could look, it could be interviews with women about what they might like from a mobile app to support treatment for postpartum depression, for example. Okay, great. So I could go in there and I could code it for themes around best times to receive support.
Mm-hmm.
I could go in there as a linguist and code that same exact data set for, how many times the women referred to their new baby in the data set. I could look for a million different things in there.
Yeah.
So I think also people are a little bit put off by qualitative data because it's like, well, I have to code every word, and and no, you don't. You have to know what you're looking for, and then you go in that data and you look for what you were looking for, and you might find some extra stuff, and that's great. But just be very targeted, and I think that will let you be super clear then when you're coming to communicating the messages in a structured way, in a way that's useful.
Yeah. No, I like that you really emphasize just the intentionality behind the research. You had talked a little bit earlier about, the need for research more upfront, kind of in the product development process. Can you share just with us a quick success story of where you've kind of seen how doing research upfront has led to either a successful launch or just really gave the team a lot of insight that they could then use for their product?
Yeah, I mean, I can think of many, and I don't want to share someone's story without kind of asking first. But the first thing that comes to mind is a startup we were working with earlier in the year, and in this case, we were discussing product development, but we were also discussing all the stuff around the product. This was a clinician-facing tool, and along with that came a lot of introductory material for the clinician to introduce the tool and talk about the tool, and in going through what the tool looks like in practice, completely changed the way the tool was introduced to clinicians.
Yeah.
And the role that the tool might play in their practice. It was a tool that leverages well, I don't really know what to say. It was a tool for treating post-traumatic stress disorder. And very cool. But I think, and another really important thing to look at in the research process, and one thing when I was working at NYU, did a lot of work in is implementation science and process. So not just the tool itself, but what does this tool look like in workflow? I think this is for human workflow as well, but for regular users, patients, but particularly for clinicians, if we expect things to get adopted into health systems or clinical practice.
That's incredible. I think what you were talking about, how even in just introducing it, building it, and then really seeing how would this tool fit in the context of a clinician's entire day of just practicing, I could imagine were very, very different from the beginning.
Yeah, I just read this really good article on LinkedIn, and of course I can't remember the title, but maybe I'll post it on my LinkedIn if anyone's interested after we hang up. But it was really focused on in all of these digital behavior change applications that are being built, really working with the fact that, with this idea of, I don't know if friction's the right word, I can't remember the word they use, but, really trying to understand and be empathetic to the fact that people, do what they do in a context. And so if we want them to do differently, we need to make it as easy as possible. And I think that goes for, people trying to exercise more or drink more water. And it goes for trying to change clinician, behavior too. So.
Definitely. That sounds like a really good article. And then last question, I know we have just a few short minutes left, but if you can just share maybe like a quick or a good first step for organizations that are, seeing this interview and are like, yes, this is awesome, I want to start. What's a good, first step for them just to kind of start learning more about the role of research and how they can use research?
Sure. I mean, you can always go to the HitLab website. You can always, reach out to me. I'm happy to, we're always happy to talk with anyone, at all. But particularly startups who, know it's important but aren't quite sure, where it fits in. Happy to spend a few minutes on the phone and, just kind of get an understanding of where research might, help now versus down the line. Maybe it isn't a right now in your timeline, but when you might want to think about it. So, definitely reach out. I think we do a lot of work as well, helping others spin up innovation groups. And I think connecting to innovation groups can also be a great way to start that innovation journey, or start that research journey, or getting to know more about, what that looks like and what kind of research is helpful when.
Beautiful. That's incredible. Well, wow, we got some good next steps. Thank you so much, Sara,
Sure.
once again for this enlightening conversation. I definitely learned a bunch.
Thank you so much. It was great to be here.
And we have some great upcoming events. We have another Women's Health Tech Wednesdays this time next week. We will be meeting with Evie and Human Venture, so make sure you attend one of those. And then we also have another event as well, which is our September symposium around digital interventions in healthcare. So be sure to check that out. And also follow us on social media, just so that you are up to date on all of our incredible events. And then also wanted to give you one last shout out, Sara. And for anyone that is interested in research, please make sure you go to HitLab and check them out. And say hi to Sara. And also wanted to thank Goodwin for being our sponsor for Women's Health Tech Wednesdays and sponsoring this amazing conversation. So thank you all. Have a good rest of the day. And thanks again, Sara.
That's Nina. Thanks so much. Bye, everybody.